symptoms of anxiety can happen to anyone. Anxiety disorders are the most common mental illness in the United States. The good news is that with the right identification and coping skills, we can control anxious feelings and stress. Avera and the Sioux Falls School District have teamed up to offer helpful information for families about topics that matter to you. This monthly series is called Family Forums, and today we're offering helpful tips on anxiety. I want to welcome my guests. With the Sioux Falls School District, Becky Thomas, who's a counselor at Lincoln High School, and Amy Morrison, who is a counselor at John Harris Elementary. And with Avera, we have Dr. David Ermer, who is a child psychiatrist. Thank you all for being with us today.
Thank you. Thanks.
Well, this is a very important topic to a lot of parents experience this. So Dr. Ermer, I'm going to start with you. I'm just wondering, we heard that it's very prevalent, but, how common has anxiety become?
Well, Lindsay, the rates are increasing, unfortunately, and there's a lot of speculation as to why, but as a group, they're the most common mental health condition in childhood. In grade school age kids, we're looking at maybe 8 to 10% of kids have some sort of anxiety disorder. And then in high school, it can go up to, some studies have gone up to a third of high school students have had dealt with serious anxiety symptoms. And the different anxiety categories, there's generalized anxiety disorder, which I think most of us, when we think about anxiety disorders, that's what we think about, because it's that sort of worrying about everything. These are the kids who have the weight of the world on their shoulders. They're worried. In second grade, you should be worried about having fun. Instead, they're worried about finances or the war in the Ukraine or something. Then separation anxiety, we used to call school phobia. It's that fear of separating from your loved ones, so it's hard to get them to school sometimes. Then you have a social anxiety, which really skyrockets in adolescence, and so that's where you see a lot of people just really struggle in social situations or public speaking. And that's, of course, where you have speech class in high school. So that can be very problematic for adolescents.
Can some anxiety kind of come and go from time to time, other than generalized anxiety disorder?
Yeah, the going from one of the diagnoses to other is the lines are blurred. So I think a lot of times you'll have somebody just with an anxious temperament. They kind of approach the world somewhat anxiously, and then they can get social anxiety. And some kids are very outgoing, and they try any new sport, music, they'd go to any activity in grade school, and all of a sudden in high school, they really start developing those, that self-consciousness, that social anxiety, those symptoms. And then, of course, in middle school, that's just normal to worry about what others think of you. That's kind of developmentally appropriate, within reason, obviously.
Yeah, let's dive a little bit more into that, what it looks like in different ages of kids. So Amy, tell us, what does it look like, anxiety in younger children, like in K to 5?
Right. As an elementary counselor, what I usually see is a few things. Like, one would be avoidant behavior. So sometimes it's kids that we are seeing with consistent tardies. Not wanting to come to school can be really typical, but when we see a pattern of it, sometimes it could be indicative of that there is something else going on. And so we work with the families and work with the teacher to help the kids, get on the right track to come to school. Sometimes we see it like where the student visits the school nurse a lot. So sometimes there's those physical complaints, and the nurse will kind of say, we've seen this kid come down the last couple weeks with stomach issues. Sometimes it has nothing to do with anxiety, but sometimes it does. And so we work with the parents and the child and teacher just to make sure that we can help get them on track. And then sometimes, parents will call and they'll say that they'll be reaching out for resources from the school, and they will have noticed more avoidant behaviors, like where maybe the child doesn't want to go see their friends and have play dates or slumber parties. Maybe they don't want to go to other activities like dance class or soccer. And then in school, sometimes, I'll see with like testing, for example. I think of last year, I had students who, no matter how much we don't put an emphasis on testing, kids get worried. And some of our high achievers I've seen this past year as well, like they get really nervous and put a lot of pressure on themselves. And so I think just seeing bigger emotions is something that we see.
Good information. Becky, how about in older kids, like middle school and high school?
Yes, similar to your elementary students, The teens in high school often have more of the internal stressors coming at them, and so they are things that really only themselves are aware of. And so their thoughts, their feelings, they might be having worries about fitting in with friends. They might be concerned with how they are looking or looking a certain way, similar to elementary with the anxieties about performance with games, fine arts activities, test taking. Students can feel irritable and nervous. They might be feeling withdrawn and easily tired and trouble focusing, or in the same sense, they might feel super wound up and on edge. Some of them might have trouble sleeping, and some of them really just, they're not even sure how to express what they're feeling, because that's just how mixed up the emotions all are. But yes, the high school students are definitely experiencing many similar concerns as the elementary students.
And Dr. Ermer, when we see extreme shifts in mood, is that when parents should get involved or really start to maybe ask, is there something different going on here?
But yeah, I think if you really see a decline in functioning, that's where you should seek professional help. And also if the student says, if it's quite apparent that they're not enjoying themselves, and I call it externalizing behaviors like ADHD. I think teachers and parents do a great job of noticing that. They can write, yeah, they're busy, but with those, we call them internalizing symptoms like anxiety. Sometimes you don't know until you ask that student. They'll tell me, I do a great job of hiding it. Mm-hmm. And so I think it's important to ask, how are you feeling? Do you get stressed out easily? And if they just say, I'm miserable most days because of my stress level, it's probably worth, it's definitely worth seeking out some professional help.
And Becky, back to you, like with parents, it's really hard to have these conversations. Do you have some tips for them in talking to their kids and starting to broach the subject with them?
Yes, I would recommend just acknowledging their fears and emotions, and be ready to listen and just let them talk, and try not to be too overwhelming with too many questions. It's okay to sit in the silence. You can model how you handle calming yourself down. So I take deep breaths when I feel anxious. Take some deep breaths with me. Let's practice this together. And you can even remind them of times when they were successful in an anxious situation, and you believe in them still, and they're still able to get through it, and they can do it. Any phrases like, I see you, I hear you, I believe in you, I know you can do this, I love you, all of these just really empower them and help them feel the security and worthiness to try to improve with their self-esteem.
And Amy, sometimes younger kids might not be able to find those words or know how to explain it. So do you have tips for helping them to feel less anxious?
I think kind of the same thing like what Becky was saying, supporting and listening is always the biggest thing. I always think with big feelings, supporting before you give solutions. So just hearing them out, and like she said, just saying like, I believe you. Because I think sometimes, myself included, we think like kids will bring up a fear and it can seem trivial. And we think in the world, like, that's not really that big of a deal. But if we can tell kids, like, I believe you, something feels really big and uncomfortable right now, like, we're going to get through this together. And so you're kind of tackling it together. Another thing I've seen be really powerful for parents is just to kind of maybe talk about a time where you felt the same way. Kind of takes away the shame of those big feelings. If you can say, did I ever tell you when I was in school, I got really worried to get called on, and when the teacher called on me, I remember feeling butterflies in my stomach, and, I didn't want everyone to look at me. So I kind of get it, so saying like a situation that you had as well can help the kids feel not alone and make it feel less shameful too.
Yeah, it's really hard as parents to sometimes sit in that silence, to understand, to not offer that advice right away, and to really listen and to just try to be there with your child. Mm-hmm. Dr. Ermer, what would you like to add to that?
I agree with everything you said. I think that irritability piece is like when we get kids referred to the clinic, a lot of times, this kid's just defiant. He just throwing tantrums. And the reality is a lot of times, because kids can't express themselves, they can't say, hey, I'm really nervous about getting on this airplane or going to school. They just act out. And so I think we see a lot of kids having significant behavior problems at home and school with anxiety. And the bottom line is that, and a lot of times we attribute it, they're just being defiant, but the reality is they're suffering from anxiety. So it's definitely worth, sitting down at a calm time and having those conversations with the kids. Hey, do you feel stressed out a lot? And a lot of times, it's a great relief for a lot of kids. Somebody's listening to me and taking these things seriously. So.
Yeah, sometimes they'll even avoid all activities, social interactions, school. That's something that I think all levels observe.
And your comments about we call them somatic symptoms, those physical complaints. I mean, a lot of these kids, especially with anxiety in the morning, it's good on the weekend, and all of a sudden Monday morning they've got a stomach ache. So they've made several trips to their doctor or to the school nurse. I think it's certainly you want to evaluate for possible stomach ups, something else going on. But it's very common to have stomach ache or, some physical symptoms when you're anxious.
How important, too, is routine to kids? Because it feels like kids are busier and busier than they've ever been before, lots of activities. So how important is communicating that as parents to kids, too?
I'll just kind of say we see that, I'm just going to start with the school lens as well. It's just really anchoring for kids to know their schedule every day, to know here's how we start off the school day. The bell rings, we put our backpack away, we start off with reading, and they just kind of know their schedule. It's very anchoring and calming to know what's coming up. So same thing at home. It can be, I think, calming for everybody to know, okay, after school I have snack, I check in with my mom, dad, then we have supper, just kind of knowing a schedule can just be so anchoring and calming for a student is what I see.
But sometimes, with that said, being able to be flexible and be able to be smooth on the fly is just as helpful, because then the whole day isn't ruined just because of a small schedule change. So flexibility is huge too, but I do agree with the routine.
Right. It's hard.
So Amy, once parents know, okay, my child has anxiety, how do you work at helping to manage it with them?
I'm always glad when they reach out. As a school, we always want to team up with the families and make sure that we're making school as successful as possible. Sometimes there's anxieties, like Dr. Ermer said, where it's short term and it's something that's just maybe just kind of situational. There's something, I've had students where they're in a really hard math unit, for example, and it's once they got over that, things were smooth sailing again. And so we were able to help them in that situation. But if it's ongoing, we always tell parents, to, check in with outside resources, whether it's ones that we know of as a school or people that they are referred to by their primary doctor.
Let's dive into that a little bit. What are some resources, Becky, that you're offering to your students as well?
I would encourage all families to reach out to their school counselor, because there might be a small group that could get started depending on need. I think that's really informative. Lots of different informational guides from the National Institute of Mental Health are very helpful as well. They can explain the difference between stress and anxiety, because stress is a normal part of life, and it can be something that is able to keep us healthy and safe. It's just when it's to that extreme and becomes a daily interference with our life tasks, that's when it becomes a challenge. And so with that, communicating is huge, and encouraging your kids to talk in general. Anytime they can talk about any kind of an emotional concern, it's going to ultimately result in helping them feel better.
Dr. Ermer, what are some clinical resources or care pathways for families if they're starting to see anxiety? They've watched this, they're maybe saying, this sounds like my child. So how do they get help?
Well, I think your point, you can go to the school counselor, they can direct you towards resources. You can go to your primary care clinician, they can direct you towards resources. The resources I'm talking about, typically for moderate anxiety, we typically recommend counseling first, so they can get them scheduled with a counselor. And then if there are significant symptoms or medications that actually can be quite helpful also.
Good. So you've given us some great advice today. I'm just going to see, is there anything else you'd like to share with parents? And I'll start with you, Amy.
I would say, I think just being a role model for, how to handle anxiety. I think Becky kind of touched on that as well, but we all feel a sense of worry at times. And I think just showing students and showing their children that, here's what happens to me. So making it, an organic moment where all of a sudden you're like, oh gosh, I feel a little overwhelmed right now. I think I'm just going to take a deep breath and then move on. You don't have to say, I'm teaching you a lesson right now, but they'll just see it being role modeled. So I think just being, trying to take care of ourselves emotionally as well as parents, and being, role modeling it for them.
Great advice. Vicky?
Yep, I was going to add to that. Self-care is huge in general. So if you can model that, that's going to just make immense gains in everything. But another thing, if students are feeling, or parents are feeling overwhelmed by stress and anxiety, there's an acronym that was developed by the National Institute of Mental Health, again, Be Great. And that just reminds you that you can try these different steps to see if it helps you to kind of bring yourself back to the present, be mindful, and kind of redirects your brain. And so G is for gratitude, and R is for relaxation, and E is for exercise, and A is for acknowledging feelings, and T is for tracking thoughts. And you can skip around, try them all, just kind of go to your go-to favorite, but that's a good distractor that can help bring you into the moment in a positive way.
Dr. Emmerich?
I was going to dovetail on what you both said, is if you have, we see anxiety runs in families. So as a parent, if you are suffering with anxiety, make sure you're getting help yourself. And then I always try to pick on the internet and the media, but I really think we know that anxious kids are really sensitive, and so you may want to monitor, are they watching? Just the nightly news can be very scary if you're trending towards anxiety. Make sure you watch what they're looking at on the internet or what media they're looking at, because that can be very anxiety provoking.
That's a great point. Like with social media being so prevalent, how much does that add to anxiety in kids?
We believe, that's one of the theories why anxiety and depression are going up in our, frankly, youth and adults, is this sort of this world of social media that's nobody can live up to, and it's very stressful.
Is there a rule of thumb when parents should consider waiting to have their kids use social media?
Yeah, just wait.
Forever.
I do. I think I would wait as long as possible. And if you do allow it, I think one of the rules has to be that I have access to your social media accounts so that you can monitor what they're doing.
Good. Well, you've all shared some really important information today. Thank you so much for being here. I'm sure many parents will be helped by this. And we have lots more resources under the counseling section on the Sioux Falls School District website, so please visit those for additional resources about anxiety. Thank you for joining us.